Welcome to another episode of Trendy with Kim Allison. And today, you guys, I'm super excited to welcome Nikkalena Caforio. She's a registered nurse and chief operating officer of Authentic Medical Weight Loss and Wellness. Did I get that right,
Yes, I know.
Nikkalena?
It's a
Yay.
mouthful, but you got it right.
I love it. She's been on the front lines of helping patients navigate these new weight loss medications, and she brings not only her medical expertise, but also a real passion for guiding people towards safe, sustainable health choices. Are you ready to get inspired, everybody? I know I am. I have so many questions for you and this GLP-1 drug. Nicolina, welcome to the show.
Thank you for having me. I'm so excited to be here. A little nervous, but more excited than nervous. So,
Oh my gosh, no need to be nervous because you know your business. You're going to crush this interview. Are you kidding?
thank you. Thank you. I hope so. And you make me feel comfortable, so I'm excited to get into it.
Oh, I love that. Again, thank you for joining us today. And as a stylist, I'm in the salon with clients all week long. And as I told you at the start of the show, off camera, um, GLP-1s, they come up all the time. You know, we have clients that are on it as hairdressers. Some admit to being on it, some don't. I don't know where I know that there is a shame element to it. I think it's less and less today, but that is and was the case. But it's definitely part of the conversation happening behind the chair. So I want to really unpack what's fact, what's hype, and what's safe by the end of this interview. And I want
Yeah.
to get that straight from your perspective as the true professional in this. Because, like you said, we have social media and everything that the TikTokers are saying and all of the content creators, and those are really all for clicks and views. I someday people will figure that out,
I
who
know.
knows. But before we get into all of the nitty gritty of it all, can you tell us a little bit about your practice, how Authentic Medical came to be, and what your approach is that makes you unique?
Yeah, absolutely. So originally this business was started by my mom, actually. So my mom is the owner. She's a medical director. She's kind of behind the scenes, so most people don't really get to see her too much. But she was on her own weight loss journey herself. She was always trying the different diets, the different exercises, having trainers, that sort of thing. And just was never really able to have anything that stuck with her. So she found out about GLP-1s probably about 5 years ago, I would say. And she took them herself and ended up losing about 65, 70 pounds on the medication, which was pretty incredible for her because she had struggled with her weight, for quite a while. So getting that weight off not only helped her confidence, but it also helped, her mental, it helped her physical. It went far beyond just the weight loss itself. So she wanted to help other people, especially people that are maybe in, whether it be their doctors, their nurses, their hairdressers, they are people that are on their feet more often, people that maybe aren't able to eat the best, people that aren't able or don't have the energy maybe to exercise at the end of a long shift or at the end of being on their feet all day. So she just wanted to make it more available for people. So she kind of started as a concierge service. And then about 3 years ago now, we have now a brick and mortar store, or not store, but a brick and mortar business inside of Palette Collective, which is where I met you.
Yes.
And we have, like I said, been there for about 3 years now and have just been growing ever since and have a pretty good client basis now, which is really nice.
Nice. And your mom, is she a medical doctor?
She is not a doctor, but she is a nurse practitioner. So I'm a registered nurse. Nurse practitioner is quite a bit more schooling. She's able to prescribe medications, hence why she is the medical director and is the one actually prescribing the medications and distributing them. I am kind of just the middleman, if that makes sense, and cover the operations on a day-to-day basis.
Yeah, that does make sense. But I know the only other time I've ever heard medical director in the beauty industry, from a hairdresser's perspective or a client perspective, I should say, is when I visit my esthetician who, to perform certain services, she needs to work under a medical director's license. But I don't think I've ever been clear on what the qualifier is, what qualifies you to be a medical director. So nurse practitioners can be medical directors.
Yes, yes. In the state of Arizona, they can. It varies from state to state, but Arizona is a pretty lenient state as far as nurse
Mhm.
practitioners go. So she is able to have her own business, doesn't have to operate under someone, and then she can oversee the medical directing and be kind of the person that we go to if we have any questions, concerns, that sort of thing, and can help run the day to day if she needs to.
Okay, Nikkalena, something I just can't wrap my head around. And there are people out there taking these medications who only have 10 to 25 pounds to lose. And that's where, for me, I understand, I get it. For people who are morbidly obese or really at risk, they risk more by not taking the drug. So I completely get that. But what about vanity, the vanity side of it? For example, I'll throw myself in the hat. For years and years and years, my thing was I never want to weigh in the double digits because I never have, right? But I'm smaller. I'm petite. I'm 5'1", right?
Mm-hmm.
So it's normal for my height. However, when I got married, I found myself 112 pounds. And I know anybody watching or listening, they're like, oh my God, like get over yourself. But for me, we all have our standards for ourselves. And I don't think there's any shame behind that. That's fine. But that is all vanity, trust, because, it is what it is. So for me, when I got to be 112, that was because, in my opinion, I got married. It's not his fault, but it is a place that I found myself just enjoying my life. So I wasn't eating as regimented as I had been. My workout was slacking, even though we met in the gym. He was still 7 days a week. Now somehow I'm like 2 days a week. Like, what happened to me? And so all of that happened. And now I'm like, oh my God, how did I get here? I don't like it. So, but this continued on over into my health. I saw my doctor just for my regular labs, and then after years of doing this, I found that I had those numbers, the pre-diabetic number, and I think
Hmm.
I was 5.3 or whatever the marker is. And he said, "Yeah, I would suggest doing more cardio." And I thought, "How dare you? Like I was the workout queen. Like what do you mean? You know?"
Hmm.
And so all of that said, all that that's all it took for me to go, okay, I need to reverse this. Let me diet, let me exercise, let me get my ish together. So that's
Hmm.
what I did, because I'm not a medication person per se. If there's something I could do naturally, that's just me
Right.
personally. But for people who may not be as disciplined as I am, for example, the old me. So if the old me walked into your business, like where's the ethical line between medical need and just wanting to be smaller? Like, what does that conversation look like in your chair? Because I'm sure you've had it.
Yeah, it can be a very difficult conversation. I probably have it, I would say, weekly
Yeah.
with patients, especially where we live, being in Scottsdale. That kind of adds a whole nother layer to it, I would say. So I have found myself having to have those harder conversations with people where, hey, you've gotten to a good weight. How about we taper you off? Or how about you decrease your dose? You don't need to be taking it every week at this dose anymore, or just asking people, what else are you doing? Are you changing your diet habits? Are you changing your exercise habits? Or are you just relying on the medication? Because we do have a lot of people that come in that say, I don't diet, I don't exercise. And I have said to them, well, how about we try those things first? Is there anything holding you back from trying those things and then maybe coming back to us in a few months if those things aren't working for you? So I definitely have to have those conversations with people. My mom has to have those conversations with people. And it can be uncomfortable, but at the end of the day, we have to let them know that we're their medical provider and having their best interest in mind. Anything that we give advice on, anything that we say to them, again, at the end of the day, is with their best interest in mind. So I think reiterating that with patients definitely hits home a little bit, where they kind of take a step back and reevaluate how they're maybe approaching us or how they're approaching taking the medication in general, too.
Oh yeah, I mean, I'm sure there's definitely a psychological piece behind it. We do that with hair as well. People are attached to these bodies, this hair, our faces, all of it, right? And that plays a big role in your self-esteem and how you feel about yourself. And then there are the vain, which there's nothing wrong with being vain. I figure I fancy myself to be vain myself,
Hmm.
but you have to have a healthy mindset. You have
Right.
to have a healthy relationship with vanity, or else you lose sight of yourself, and that dysmorphia kicks in where, do you see how thin you are, or that you don't need to be any smaller, for
Hmm.
example? Do you see, what we see? And the
Exactly.
disillusion kind of checks in, right? So I appreciate hearing that you guys do have those ethical conversations, because I imagine that there are doctors who don't.
Absolutely. Yeah. I mean, there are plenty of doctors and providers out there, I'm sure, that just want to make money at the end of the day. But that's not really how my mom and I operate. That's not how I was raised. That's not how she was raised. She was raised in the South. We care
Mm.
about people. Maybe a little too much sometimes. But we really do care about people at the end of the day, and we don't want to influence anyone that may already kind of have some of those, like you said, dysmorphia tendencies. We definitely, there's a fine line for sure. It can be challenging, and I've had to get a lot better at having difficult conversations with people. So that's been a hurdle for sure over the past few years.
Yeah, so to wrap that up, short and sweet, when I was 112 and I had that number and I walked into your studio, I did have that pre-diabetic diagnosis, and I walked into your studio. What would you have done for me?
So first and foremost, would have asked how your day-to-day diet is, would have asked how your exercising habits are, also would have asked kind of any other pertinent medical history, if this pre-diabetes runs in your family or if it just kind of came up all of a sudden. Because we do treat people that are still technically in a healthy BMI, but they may have pre-diabetes, or they may have very high cholesterol or very high blood pressure, and those sorts of people technically aren't qualifiers as far as their BMI goes, but they have other comorbidities that the medication can help with. So for someone like yourself that was pre-diabetic, absolutely. Because you could have used it to not only get some of that weight off, but also to lower your overall hemoglobin A1C too, which would just decrease your likelihood of developing type 2 diabetes later on in life.
Ooh, that's very important. Thank you for that. I'm sure the audience definitely got a little education there, because I certainly did. I would have never placed myself in that scenario, but absolutely, that makes perfect sense. Yeah, that's a responsible way to use the drug. So let's talk a little bit about compounding, in the end. Now I know it's been banned, I want to touch on it a little bit though, because that's also been a hot topic. I know the FDA has basically forbidden compounds like semaglutide and what is it, trizepatide or whatever it's called. I think that's what it's called. Now
Yes.
that yeah, now that the drug companies have their supply under control. What happened to everything that was already on the shelves? like the gummies. Like there's a brand on Instagram called Hers that's always promoting the
Yeah.
shot. The shots people have been getting are the direct to consumer products like that I just said. Did distributors throw it all away, or do you think some providers are still giving it? And if they are, what are the consequences?
Yeah, so there are definitely loopholes around the overall distribution of semaglutide and tirzepatide because there are brand names versus, those off-brand names. So like you hear Ozempic and Wegovy, those are typically what you're going to get, from your doctor if they prescribe you that medication and you get it through insurance. Someone like us, we don't accept insurance, so we do everything out of pocket. So we typically went with compounding pharmacies in the past because they've been around for years. They've always been considered safe and effective. There are still pharmacists that are working at them. All of their medications, go through extensive testing processes to determine their purity. They determine their potency and also the stability of the medication as well. But as far as these other brands go, they can still technically advertise because it's not the same name, if that makes sense. And a
Okay.
lot of a lot of what is making up the gummies or the shots or the pills is not the exact replication that the FDA has patented. So they're kind of able to go through a little loophole because some ingredients may be slightly altered to where it is not technically an exact duplication of the medication. Now, there are consequences, of course, if you are continuing to compound the medication exactly as the FDA has it, if that makes sense. But as long as you're following the guidelines as far as, again, putting it through those testing processes and making sure that it's not just some willy-nilly gummy that they're selling out there to people. But these things do go through testing processes. So it's in the back of our mind, we know that all of those items that are being sold out there, with hers and hims and row and all those different um, weight loss supplements out there that you can get, they are still going through those testing processes, but they are still able to make them because it's not an exact duplication. So,
Ah, I see. So what the FDA approved when semaglutides and trizepatides came out, that was their compounded version of what those bigger companies were using. That drug, that what do you call it? That analog, I think is what they call it, was GLP-1 synthetics, right?
correct. Yes.
Okay.
So
Okay.
GLP-1 is kind of a broad spectrum term because there's GLP-1, there's GIPs, there's some newer medications that are being FDA tested and going through trials right now that also have glucagon in them. So there's all sorts of different types of these GLPs, but we kind of use GLP as like an umbrella term for it.
Okay, got you.
Mhm.
And I did a little deep dive. I was learning so much trying to prepare for this interview. And GLP, it was, I know it's like peptide, glucagon, correct? Like peptide, glucagon.
Glucagon
Thank
liked
you.
peptide. Yes, it's a mouthful.
Yeah, and then I also, fun fact, I also learned that the original form before they came up with the synthetic, like the natural, more natural form, was from the saliva of a lizard, of a Gila monster.
Okay, I did not know that, but that
I
is
didn't either. So thank God for the synthetic version because that
yeah.
sounds but
Yeah,
and
that
maybe
sounds like a lot of work.
yeah, and for all the people that are on it, I don't think we would have enough Gila monsters in the world to catch up.
Mm-mm. Mm-mm. Yeah, there would be a shortage.
For sure. Okay, Nicolina, let's talk dollars. What's the average cost to be on this medication? Is it covered by insurance, which you say in your facility it's not, or monthly out of pocket, which for some people it is? I'm sure, I don't know if it's ever covered by insurance, but realistically, is this a drug people are expected to take for life? Is it actually affordable, or could we see the price go up in the future where it's out of reach?
It kind of depends on what path you choose to take. So you can go to your doctor and see if your doctor will prescribe you the medication through your insurance. If you have type 2 diabetes, sometimes if you just have some morbid obesity or severe obesity, you will qualify. But I believe that it's difficult to qualify through insurance. So some doctors kind of have to go back and forth with insurance companies. But we have had some patients in the past that started with us and then were able to get it covered by insurance, which is awesome. Um, because those people truly do need it, and for it to be covered by insurance is great for them. But there's also the option, kind of like with us, where we are more of like a med spa or weight loss and wellness center, where we pay out of, or we have our patients pay out of pocket. So we do not go through insurance at all. Some of our patients have been denied by insurance multiple times, so they have to come to us and pay a little bit out of pocket. The price can vary. With us, it's about $350 a month. And that includes the 4 injections. And then once monthly, we have you come in and meet with either myself or my mom. New patients typically meet with nurse practitioner, which would be my mother, and then from there they can come and see me. But that also includes that follow-up visit. We include labs as well. We will have labs run, of course. We do a baseline set of labs to make sure that you're able to even start the medication. And then we do labs periodically to make sure that all of your lab work looks good and you're not having any crazy side effects from the medication. And then there's also options like HERS, HIMS, row, those sorts of things where you can just pay for a monthly subscription online. And with that, you are just getting the medication shipped to your doorstep. Typically, there's not usually someone that you can talk to if you have questions right at the tip of your fingertips. You usually have to go through, an email server or an app or something like that to talk with them. So that is a little bit cheaper in the beginning for people, but those prices do tend to increase as your dose increases. We typically keep the price the same with our semaglutide, even when your dose is at a higher dose.
Okay. All right. That's good to know. So there are cases where your insurance will cover this, but that would be a more serious condition, I would imagine, if you were 400 pounds plus, or your insurance probably would cover it. Or if you have type 1 diabetes, I would imagine it would cover it. But everything else is kind of wait and see, sounds like.
Pretty much, yeah. Everything else is kind of wait and see. We're hoping that maybe as it becomes more popular, that the price will be able to come down a little bit. As of right now, the prices went up as far as purchasing costs on our end because of everything with the FDA. So maybe once time kind of goes by, that will go back down to more so what it normally was. But I'm hoping that it'll eventually be more accessible for people and hopefully be more accessible through insurance as well, even if you do just have high cholesterol or high blood pressure, because the medication has a lot of cardiovascular benefits as well. So I'm hoping as time goes by that there are more ways for people to access the medication more readily for them.
Perfect. Now, which brings me to the big question. All the clients are asking me about this. What happens when you stop? Like, do people usually keep the weight off, or does it come back? And I say that because I had a client tell me that her friend, who was diabetic, she was able to come off of her diabetes medication because the Mounjaro, is that how it's
Mhm.
pronounced?
Yes.
Mounjaro, it was working. So she lost an exorbitant amount of weight. She was able to come off of the diabetes meds she was on, and the weight is now back. It's coming back while on Mounjaro. So help us understand why this would occur.
So that also kind of depends on the person. So with the medication, we typically, like I've mentioned, also want to instill some sort of lifestyle changes. A lot of these people might be more sedentary, or they might be people that go out to eat a lot. So we encourage them to maybe start to become a little bit more active, even if it's going on like a 15-20 minute walk with your dog a couple of times a week, or even if it's playing with kids, grandkids in the backyard. It doesn't have to be anything crazy. And then as far as dietary choices go, just encourage more whole fruits, more veggies, more protein. We don't ever encourage, starving yourself, or if you want a burger, we say, if you want a burger, have a burger. We're not going to ever tell you not to do that.
Mhm.
But again, those people that maybe the weight comes back on after they stop, it typically is just because they were relying very heavily on the medication and they maybe did not make those changes in their life. So that is usually when we'll see that weight come back on. We encourage our patients to kind of taper off of the medication so that you're not coming off of it cold turkey, because that is usually when you see a little bit of rebound weight gain, is just because your body is shocked. It's been getting this medication, every week for months on end, and then all of a sudden it's not getting it anymore and it's come out of your system. So you'll have a little bit of rebound weight gain with that. But most of our patients that have come off of it will fluctuate, 4 or 5 pounds, but it's not too big of a weight fluctuation because I think that they've really implemented those lifestyle changes. A lot of patients say, they crave more fruits, they crave more veggies, they aren't reaching for the chips, they aren't reaching for the ice cream, they're wanting a smoothie instead. So it's just little things like that. And we find that the longer that patients are on the medication, the more time your body kind of has to adjust to your new set point or your new metabolism, essentially, because it is changing your metabolism and how your body processes food, how it metabolizes food. So the longer that you are on it, the more time that your body has to kind of adjust to it, if that makes sense. But
Mhm.
as far as her continuing to gain or losing, or you said she's gaining, right?
Right.
As far as her gaining weight, sometimes what happens is you've been on one dose for too long. So, what we will actually do is decrease their dose slightly, maybe bring it down a couple of notches. And then, usually, people will, for whatever reason, I don't really know the science behind it, they'll, for some reason, start to lose a little bit again. And then we're able to bring them back up. And then, over time, they just start to taper back off as far as their weight goes. But it could definitely be that maybe she's just gotten used to the medication. She isn't maybe watching what she eats quite as regularly. A lot of people just get a little bit more lax with it, especially if they've been on it, 2, 3 years. It just isn't really on the forefront where they're thinking about what they're putting in their bodies, what they're thinking about exercising, that sort of thing. So
Yeah, no, that makes sense, and it sounds like you have systems in place to kind of combat this, or you have the antidote, and you can pivot when you need to pivot, but it's not just an end all be all, too bad, so sad type of situation. So thank goodness. I'm sure people will be very happy to hear that.
yeah.
So we talked about the weight gain. Now let's talk about side effects, because they're another big concern. I hear about nausea, but also some serious stories that I've heard from behind the chair. For example, I had a client tell me that her friend, she went blind after being prescribed Ozempic. And I say that allegedly because I don't want the Ozempic people coming after my little tiny broadcast. But
Exactly. Yeah.
had diabetic retinopathy, and apparently it clashed with this particular weight loss drug, Ozempic. That kind of side effect also apparently is irreversible because she's still seeing just spots of gray. She can no longer clearly see. So, my question is, what guardrails do you have in place to keep customers or patients safe?
That's a great question. And first of all, I that's a horrible horrible story. That's definitely kind of worst case scenario with these types of drugs. So, one thing we always ask all of our patients about is, do you have any sort of retinopathy going on? Do you have any sort of vision changes lately? Because those that is something that we need to document if they already previously are having vision changes. I think that just kind of sounds like it was just a bad case, which
Mm,
it's I hate to say that that's just how it was, but um that's obviously worst case. But we
mhm.
also ask our patients, there's a couple of different different I don't know what the word is for it, but just a couple of different criteria. Yeah, a couple of different criteria that cannot be present. So, one of those being if they have any family history of medullary thyroid cancer. So, not to be confused with the papillary thyroid cancer that is much more common. Medullary thyroid cancer affects a very small percentage of people, but it does disqualify you from taking this medication. So, that's one thing. And then another is if you have any sort of history of gastroparesis. So, gastroparesis is essentially where your gut slows down and you are not able to process foods as quickly as you should be. And you aren't really absorbing the nutrients either. So, a lot of people have, severe nausea, vomiting, bloating, a lot of GI issues. So, this medication further slows down your gut. So anyone that has any sort of gastroparesis would also be someone that we would not consider. And then also any sort of history of multiple endocrine neoplasia syndrome type 2, very fancy long
Yeah,
word.
yeah.
But and most people have no idea what that is. And it's very rare, and we have never had anyone so far with that in their family history, but it is just an outlier that would disqualify someone from taking this medication. And then of course we have people that are trying to get pregnant. We always ask, are you trying to get pregnant or are you pregnant? Because pregnant or people that are trying to conceive, this medication is not recommended for. There haven't been enough studies done, and there haven't been enough pregnant women that are like, sure,
Yeah.
I'll take that while I have a baby inside of me. So that has not been approved as well. And then there are some type 1 diabetic patients that we just have to monitor more closely because those patients, the way that they process insulin is very different. So we just have to be a little bit more cognizant, let them know to maybe set their parameters on their glucose monitor a little bit differently, maybe make the parameters a little bit smaller so that they don't have as much wiggle room, that sort of thing. And we always just say, if you have anything out of the ordinary, any side effects, just call or text us. Ask us, if there's something out of the blue, we would rather you let us know and ask, even if it might not be related to the GLP medication. But we always just say, if you're have any sort of concerns, just ask us. It's easier to ask than to go to Dr. Google, because Dr. Google usually has some scary, scary diagnoses for people. So,
Oh, yeah, I've been sentenced to death a few times.
yeah.
Doctor Google.
hmm
He's not fun.
No, he's not a nice guy. So I prefer to just let people know, if there's anything that you have questions or concerns about, just ask us, because there's never a dumb question, especially if you're not in the medical field or don't have any medical background. It's always better to ask.
Oh, yeah, and it sounds like, man, n now if there was ever a time to, what's the best way to say it? To kind of research, do your homework before you even enter into this appointment. When you're filling out that intake form, it's more important to me than any form I've ever filled out that you know your family history, because this is going to affect your DNA is going to change,
hmm
because you're introducing something that is forcing your body to do something it doesn't naturally want to do, right?
Right. Yeah, exactly. Yeah,
Yeah.
it's definitely important for people to know that if they have any sort of significant family history, knowing what medications you take, because you'd be surprised at how many patients come in and I ask what medications they're on and they don't know. So those are all
Mm.
very, very important things as well. Is just to be aware of your own health if you're going to be taking this step to take something that is potentially dangerous. There's obviously always going to be side effects with medication, so it's better to be informed rather than to just be kind of loosey goosey about it.
Yeah, but I'm telling you what, you can tell someone how to eat healthy. I've done it behind the chair my whole hairdressing career, "Kim, what do you eat? What do you do? Da da da, blah blah blah." You can tell them if you eat this, this is going to be better for your gut health. They'll go, "Oh, okay." But if you say, "And you'll lose weight," "Oh, I'll lose weight. Okay, now I'll do it."
Yeah. Hmm.
That losing weight part, woo, that's
Yeah.
like, I think that's more valuable than money to some people. I'm not even joking, you know? So I have to bring this up because behind the chair, this is one of the first things clients ask about. And honestly, whether they reveal they're on the drug or not, they are fearful of the hair loss. It's a whole thing. I've had clients admit, like I said, that they're on GLP-1 medications and worried about shedding. And I've also had those that don't admit it, who you can tell are just internally struggling with the fact that their hair is falling out or shedding, I should say. So as a stylist, I do know that hair loss from weight gain or weight loss rather in particular is usually something called telogen effluvium. And that word, I always, me and words, we do not get along, but telogen effluvium. And that's just a fancy way of saying the body has, it's hit a growing stage and there's no more hair, right? It's just stopped growing new hair, in other words. Because when your body obviously is going through stress, whether it's surgery, illness, or in this case, rapid weight loss, the body gets rid of what it doesn't need, and it doesn't need hair to survive. So it just is like, okay, bye hair. You're
Hmm.
not important now, right? So all of that, and then of course, we don't see it coming because it didn't start when you start shedding. It started months before, and then the shedding comes, and all of a sudden we're in this panic of, oh my God, what's happening to my hair? Right. So it's not always the medication itself. We know it could be speed of the weight change and the way it affects our nutrition. Let me ask you, the medical professional, is hair loss a given side effect with the medication, or is it more about the rapid weight loss and nutrition piece?
Yeah, that's a great question. So I would definitely say it's more about the rapid weight loss and the nutrition piece of it. So the medication itself does not cause hair loss, but it is the weight loss itself that causes hair loss. And then obviously the body maybe not getting as many nutrients in just because the medicine does make you not quite as hungry. And it also changes how your body metabolizes certain foods, certain nutrients, even medications as well. So I typically tell my patients, make sure you're getting in, your vitamin D, your vitamin C, take biotin if you need to, take folic acid, take a multivitamin. It's good to get on top of it before it starts to happen because we have had quite a few patients, that have lost 40, 50, 60 pounds that have also lost a significant amount of hair as well. And that's kind of like a trade-off. They say, do I want to lose weight or do I want to have thick, luscious hair? And, some people don't lose hair at all. It just kind of depends on the person. But like you said, it starts sooner than when it begins to happen. So that's why we always recommend, just making sure that you're getting in your vitamins and minerals, making sure that you're eating 3 meals a day, making sure that you're getting in enough protein. Protein intake is a really big thing to do with hair growth and hair loss. So we always make sure our patients are getting in, a decent amount of protein, whether that's, around 100 grams or so a day is usually what we recommend for patients. Now, do people get that a day? I would say probably not. Most people,
Probably not.
that can be difficult to get to. But if you're able to stay on top of your protein intake, your different vitamins and minerals, you will see lesser hair loss. But again, it's not from the medicine itself. It's more so because of, like you said, the rapid weight loss, and then also the depleted vitamins and minerals from just not eating as much.
Yeah, and are there any early, like, warning signs, even as stylists, that the patient and us as stylists can look for, just to say, "Oh, it's time to increase our protein," or does it just kind of come out of nowhere?
Yeah, if you notice that the hair is becoming more brittle, you're brushing through it
Yes.
and it's coming
Yeah.
out, it doesn't even need to be coming out from the root, it could just be breaking off, that sort of
Yeah.
thing. If you notice a lot of unevenness in the hair,
Yeah.
especially when you're holding up the hair, to see kind of where maybe the ends start to split, that sort of thing. If you
Mhm.
notice more of that going on, I would say maybe it's time to have a conversation with them about increasing their protein, or just changing their dietary habits, introducing more vitamin C, vitamin D, biotin. There's so many different hair supplements now too that you can take out there. I know they can be pricey, but we have had a few patients that have taken Nutrafol, and have had great success with Nutrafol, which is awesome. So there are ways to combat the hair loss for sure.
Okay. Well, I love that. That's good to hear. And one more thing for patients who are worried about shedding, what's the best advice you give? I guess that's what you just said. Cuz it's both, it's all nutrition, supplements, patients, anything else, is that pretty much it in a nutshell what you just offered us?
Yeah, pretty much. And then I also ask, are you putting a lot of heat on your hair, or is there anything
Okay.
else that you've maybe changed? Have you started styling your hair differently? Like, for instance, my hair's always been pretty thin, but the last 3 or 4 months, I've noticed my hair falling out rapidly as well. And I don't take the medication. I've gotten all of my hormones checked. I've gotten my vitamins and mineral, everything checked, and everything checks out. Um, so I've just kind of had to take a step back and look at my actual hair care routine. Sometimes the routine that you have may not be what is manageable for your hair. Your hair texture may have changed from when you first started the
Mm,
medication. You might be using products that aren't necessarily made for what your hair texture is now, because we have had some people that their actual hair textures changed a little bit. The porosity, or I think that's the word, the porosity of their
yeah.
hair has
Yeah.
changed,
Mhm.
and just their overall thickness and fullness, and maybe even if they're a little more flaky or they're a little more oily. Those are all things to take into consideration too.
Okay. Yeah, that's important to know. Thank you for breaking that down. I think this is one of the most practical things our audience will take away from today's interview. And it also, as stylists, it gives us just a little bit more education so that we can go in with more confidence. Because half the time, I mean, honestly, our Milady beauty school book, it didn't talk about all the things that we're faced with today working behind the chair. It just didn't, and we're not dermatologists, but a lot of the questions come our way because clients don't see their doctors as often as they should, unless it's um extreme something, right? They
Hmm.
won't take those just daily steps in order to have optimal health. Like something has to be wrong for people to really for the alarm bells to go off. So all of those things were very helpful tips and I so appreciate that. I've also heard something interesting about this weight loss drug and or GLP-1s and surgery that people have to taper off like a couple of weeks before having anesthesia for whatever reason, one of my clients broke down the reason, but it literally went this way and out that way. So I'll let the expert tell us what is the reason for this and why is this so important?
That's another really good question because we do have quite a few patients that, will go through for routine procedures, things that come up, that sort of thing. So it is really important that you stop taking the medication about 10 to 14 days before you have any major surgery, or any minor surgery, really, that's going to be putting you under an anesthetic, whether that's a general anesthetic, whether that's more of a twilight sedation. And that is specifically because GLPs slow down your gut. So they slow down how quickly the food is absorbing and moving through your gut. So food takes longer to digest. So if you are going in for a surgery and they need to put you to sleep and you have no airway and you have food in your stomach, it's possible that that food in your stomach can kind of come up and you can aspirate on it, and it can go into your lungs, which causes aspiration pneumonia, which is very serious. A lot of people have to be hospitalized for it. So it's basically just a choking hazard essentially. So they were finding that patients that were not stopping these medications, they would maybe go to do a colonoscopy, which is not a general anesthetic. It's typically they use propofol for a colonoscopy, which is going to put you to sleep, but it's not requiring a breathing tube down your throat. But even those patients, they were finding the food was coming back up. They were having a hard time. They were having some aspiration pneumonia instances. So collectively they just all kind of got together and said, let's just make this a general thing that we know that any sort of surgery or procedure that's coming up, it's a good rule of thumb to stop it 10 to 14 days beforehand.
So aspiration, is that what you said? Pneumonia? And is
Yes.
that something's getting caught in the lungs coming from the gut? That's what that means.
Correct. Yep. Yeah. Or even sometimes people that are chewing, sometimes you can chew something and somebody that maybe isn't able to clear their airway, if they're coughing on something, it can go down into
Mm.
the lung and that can cause some sort of infection as well. I've seen it in the hospital many times, unfortunately, where people end up choking on like an egg or choking on, a piece of bread, and it goes down the wrong way and ends up going into their lung, and they end up getting really bad aspiration pneumonia from it. But it can definitely happen. And it's definitely more common if you have that food that's still in your stomach. That's also why for surgeries they typically ask you to not eat anything after 12 a.m., that
Mm.
day, because they don't want anything in your stomach just in case it were to come back up.
Thank you for that explanation because that's something I never understood why I couldn't eat. I'm like, "Why can't I eat?" I'm going in well, I got it, the colonoscopy, but just surgery in general, right?
Hmm.
But, yeah, thank you for clarifying that. Now, let's talk about something a little lighter. Well, it might be for some people, not for others. Cosmetic, right? Because we all love vanity, like I said. And really, for a lot of people, in my opinion, this weight loss drug is less about health and more about cosmetic, more about aesthetics, right? Some people on GLP-1s seem to show signs of aging in their face differently, I should say. You've heard of Ozempic face, I'm sure. Yeah.
Of course. Yep.
So, why does that happen to some people and not to others?
So a lot of it has to do with age. So, a little tidbit, after the age of 30, we no longer produce any collagen. So from 30 on, our collagen levels just slowly decline. And when you lose weight, you are also losing collagen as well. And a lot of people have a lot of extra weight in their face. So those people, obviously, if they're losing weight in their face, they're going to look a little more sunken in. They're going to have a lot more loose skin. They're going to maybe have some more wrinkling just because they had more volume that has now been lost. So we do have some patients that have lost some volume in their face, but a lot of our patients find that if they're not losing rapidly, if they're losing between 2 and 4 pounds a month, that is far less likely to happen. It's more so those people that are losing, 15 pounds, 20 pounds in 1 month that are obviously going to see that um, Ozempic face, as you would call it, they'll obviously see that a little bit faster than people that are losing weight more slowly. And some people just unfortunately age worse, age worse than others. It has a lot to do with the ligaments in our face, and over time, gravity just slowly tends to bring everything in our face down. And then adding any sort of rapid weight loss on top of that will just further exacerbate how old someone might look.
Yeah, that makes perfect sense. And going back to what you said earlier, I think people don't always realize that it isn't a quick fix, right? It's not like you take it for a few months and then you're done. It's really a lifetime medication, or am I wrong? Because I find that maybe some people understand that and some people don't, but how do you approach that topic?
So we always like to set realistic expectations from the get-go with people, because people do want to lose, I want to lose 15 pounds a month and be done in 3 months. And that's one, not healthy, and two, just not really realistic. So we always like to preface our initial appointments letting people know, people are really only losing around 2 to 4 pounds a month. So if you're doing this, you're going to be committed to it for quite a while, depending on how much weight you want to lose. So, we have had some people that have been on it for, maybe only 4 months or so, and they've hit their goal, but those people maybe only wanted to lose 12 pounds or so. And, after 3 or 4 months, they've hit that mark, and then they're slowly able to taper off or lower their dose. But we're finding that a lot of our patients are staying on it long term once they've hit their goals, at a lower dose and at a lesser rate. So right now it's an injectable weekly medication. So some of our patients are now injecting every 14 days, every 21 days. Some of our patients inject just monthly at a very low dose. And that is not as much for the weight loss aspect of it, but more so for the anti-inflammatory benefits, the cardiovascular benefits. It has a lot of effect on liver function. It has a lot of effect on blood sugar in general. So a lot of our patients like it for those reasons, more so than, I guess, the weight loss purpose of it. Because, like you said, a lot of people are on it just for the weight loss aspect of it, but we do have a small amount of people that are on it for other reasons as well, that like it for the anti-inflammatory benefits. Like my mom now takes it about once a month, and that is strictly for the anti-inflammatory properties, because we have a lot of Alzheimer's and dementia in our family. And they're
Mm.
actually doing trials with GLPs for patients that have Alzheimer's and dementia, because it decreases inflammation in the brain. And a lot of the links to any sort of cognitive or memory decline has to do with the inflammation in the brain. So they are finding that this medication actually helps to slow down or decrease the instances of patients developing Alzheimer's, which is really awesome. So.
Oh, that's beyond awesome. What a breakthrough. Wow, I didn't know that. That's a fun fact. And, okay, so people can take this forever if they do it responsibly. This is not a risk to take this forever.
Correct. It's been around now for a little more than 10 years, but it's obviously become more popular, I would say, in the last 2 years or so. So there are diabetic patients that are started taking it 10 years ago and are still on it today. As long as you're not having any major side effects, your lab work looks good, you're not, like you said, using it irresponsibly, it's definitely a medication that can be used long term. But there are also people that maybe don't want to use it long term, and it can be stopped. Again, it just needs to be done over a period of time where it's not just cold turkey where someone comes off of it.
I know I'm going to sound like a stylist right now, a total hairstylist and not a medical professional, but I've always wondered, first, can people be tested for their natural GLP-1s? Would that tell us who needs the synthetic version, for example, if that makes sense?
Yeah, so I'm not entirely sure if there's a specific test that could test what your level of GLP-1 would be. But I mean, I know that there are all sorts of blood tests out there, naturopaths, homeopaths. There's so many different blood tests that you can get done that I imagine that there would be some sort of way to tell whether your body had a significant amount, whether it was had a lower amount, if it had a regular amount, because I do think that this medication over time will become more readily available for people. And for instances like that, maybe there will be eventually a test where you can go and you can say, do I qualify for this? Or,
Mhm.
is there anything else I can take? Because there are other drugs, other supplements you can take that will naturally increase your GLP. It just semaglutide is, like you said, the synthetic version of it, but there are other
Yeah,
things out there.
yeah, and I have a client, she did everything. She works out, she changed her diet, she did Noam and Loom or whatever the other one, the Weight Watchers, all of it. She was a spin instructor for God's sakes, and the scale would not move for her. They put her on the highest dose. She started on the low, then went to Mounjaro, I think. Did not touch her. She was the same weight, and she's considered overweight. So she finally went and got lap band surgery, and now she's starting to see the shift. But I wonder why some people, your body just hangs on to weight. That's why I asked that question. I know it sounded dumb, but I'm like, I
No,
know it's something we all have these GLP-1 molecules, right? In our bodies. Yeah.
correct.
So
Yep.
I just wonder why some people they metabolize whereas others don't. So yeah, I appreciate that explanation. So, Nikkalena, thank you so much for sharing all of your wisdom with us today. These are the exact questions that people are asking behind my chair. So, I appreciate you giving us all the clarity that we need. So, for people listening who might be curious but nervous, what would you want them to know about working with a clinic like Authentic Medical Weight Loss and Wellness?
I think I would just like for people to know that, for one, when you're meeting with my mom, you're meeting with someone that has taken the medication themselves, and can speak to the benefits of it, and can also speak to some of, the personal side effects maybe that she had. So I just want people to know that we want to help them. We are not there to take their money. We are not there to short them on medication. We are there to give our best medical expertise and our best medical advice. And we really want to be a team, and we want to work together so that at the end of the day, we can help you to reach your goals, because that's what we want. We want everyone to be happy and feel good about themselves and their body. So that's just kind of our overall mantra.
Oh, that is perfect. Do you hear that, everybody? I hope that this was education for you and that you leave informed. And now you can make those choices with the information that you need to be successful if you choose to go down this weight loss journey using the medication. Yeah. And I learned so much because I'm not going to lie to you, Nicolina. I was such a hater in the beginning because I'm like, there is no way I am working out, eating right, and then somebody else can just take a shot and da da da. And then I realized, Kim, mind your business. Literally, that has nothing to do with you. Everybody, they are genetically designed differently. You don't know what someone is going through. You have no idea of what anybody's lives consist of. So shut your mouth, mind your business, and worry about your own health. Okay, ma'am. That's what I told myself.
I
So
love
thank
that.
you for all of that. Well, Nicolina, nobody gets out of here without my 60-second blowout. Yes, I do a rapid fire at the end of every show. You have 1 minute to answer all of my questions. And yeah, let's go. Are you ready?
Okay, I'm ready.
Favorite TV show?
Ooh, I just finished The Sopranos for the first time, and I think I'm gonna have to go with The Sopranos.
Do you like every client you have?
No,
Name one thing you change about your industry.
unrealistic expectations.
What would you do if you woke up and you were a man?
He's standing up.
Dream client, dream celebrity client.
Oh, I would love to see Gabby Wendy from The Bachelorette. I love her.
Which celebrity would you avoid?
I hate to say it, but Tom Cruise.
Nights or mornings?
Neither.
Gym or church?
Jim.
Ah, you did good.
Mm,
I
that was
like it.
fun. I love that. That was
Yeah.
fun.
I'm gonna ask you 5 more questions just because I like to
Okay.
ask more than 8 questions. Po Politics or reality TV?
Lately, reality TV.
Word. What's your superpower?
I think making people feel good about themselves.
And on that note, I think that's perfect. And I believe that about you because you have such an energy. It's so inviting, and I'm sure all of your patients love you. That said, where can everybody find you? Because I know they're gonna be beating down your door now.
Yeah, so we're located inside of the Palette Collective. It's right off of Talking Stick and the 101. We're next to Famous Footwear and Owl Ear Cigar Shop, but we're Suite 6 and 7. We do GLP therapy, we do peptide therapy, we do hormones, we do Botox, filler, microneedling, you name it, we do it all. So,
Perfect, and Palette Collective, everyone, it's 8920 East Talking Stick Way, Suite A2, Scottsdale, Arizona, 85250. Do you have a social media presence? Do you have a digital footprint? Do you have a website? What's your website?
yeah, so our website, you can just type in Authentic Medical PLLC on Google, but it's authenticmedicalplc.org.com, not .org.com. And then we have an Instagram, it's authentic underscore medical underscore. And then we also have a Facebook page as well. It's just Authentic Medical Weight Loss and Wellness. So you can find us on there too.
Okay, perfect. Until next time, I'll talk to you soon, Nicolina. Bye.
Thank you. Bye.